The Gauteng Health Department has sounded the alarm over a spike in food poisoning cases, especially among children in townships, informal settlements and hostels. This follows a tragic incident last week where 7 children were rushed to Thelle Mogoerane Regional Hospital with suspected food poisoning. Sadly, we're told 6 of these children have now died. 1 of them is still in a critical condition. The department is urging local shop owners to adhere strictly to hygiene standards in order to prevent further incidents from taking place. Let's understand the issue a bit better, hopefully. Bring in now Gauteng Health Department Spokesperson, Motalatale Modiba, who's with us via our video link this morning. Devastating what's taken place, Motalatale. Thanks very much indeed for making time to speak to us. What else do we know around what happened specifically to these children last week?
What we do know, thank you, Ayanda, for having us. What we do know is that we've got 4 children in 2 separate incidents related because of the issue around food poisoning. In Garangua, we've got a 4-year-old and a 6-year-old who are siblings who unfortunately demised after they suffered from what we suspect to be food poisoning or foodborne illness. They had actually taken a meal at home, and I think from that they then obviously had symptoms, and they were taken to hospital. Unfortunately, they both did not make it. And then in Ekurhuleni, in Vosloorus, we had also an incident where again 2 young children were also affected. In this one, what we understand from what we're able to gather is that they ate potato chips, and they've eaten something else as well, but they ate potato chips, and they then, they're aged 3 years to 5 years, they also exhibited those symptoms where they were vomiting and then they were body weakness and so forth, and they were rushed to the community health center, J2 Community Health Center. Not at the same time. I think it was the first one who was rushed there, and then the second one also was presented there. And what you understand there is that an elderly person who is an uncle to one of the children would have shared with the 3 children some potato chips, and the 3rd child is actually was taken to one of the hospitals where they are currently still receiving treatment. So in one instance, it's a meal that was shared at home. In another instance, it's some chips that were bought and they were consumed. Of course, the results from this would be what confirms exactly as to what is the cause. What we know now, or what we suspect, we're saying it could be foodborne illness.
Right. What's difficult in this matter, and in fact, this is not a new story. We have spoken multiple times, you and I, Motalatale, of children ingesting toxins, even without their knowledge, and in some instances, it's unfolded at schools. But the point I'm trying to make now is that what's difficult is that this seems to be a home-based issue, which is very hard for government to regulate. Because how do you force people to run their homes in particular ways?
I think, Ayanda, what we're trying to do now, with government working with multiple stakeholders, working with the local authorities through the outbreak response team, is to really heighten the awareness, and hence the plea that we've made to say we're appealing to parents, we're appealing to guardians, we're appealing to caregivers to really exercise caution when looking after the young ones. We do know that sometimes people use pesticides in their own homes to try and get rid of rodents and cockroaches and so forth. But the problem there is that sometimes people don't apply those things correctly, and it ends up posing a danger to the very children or the very people they're trying to protect within their homes. But also, again, another issue that we're seeing that is problematic is the continuing illegal dumping that we see in many of our communities, where people then just throw garbage just anywhere. And what we forget is that after school and so forth, children go to those places, they start playing there and so forth. Sometimes the chips that one is eating might not necessarily be the problem. It might be that as I'm playing as a child, the child touches the ground and the area is contaminated, and automatically with many of these poisonous substances, once it's on a surface and you touch that surface, you consume whatever without washing your hands and everything, you are likely to be affected. So we're saying we need to make sure that we clear our environment, we desist from illegally disposing of garbage and so forth. But secondly, in the households, how we utilize these detergents and all these other things that we're using within our households, we need to be able to make sure that we keep the home clean and we keep those things away from children. But thirdly as well, it's important that we conscientize our children as well, even from when they're buying food, just basic things of them being able to look at the label to say, if the label says the food is expired, don't even consume it and so forth.
Yeah.
So I think there are certain practical things at a community level, at a home level, we can be able to do. On our side, we're trying to increase the level of awareness, and obviously we're working with multiple stakeholders, and I think even the different local municipalities, from a point of view of environmental health enforcement, they're trying to, I think, work on that. But it clearly is not enough, given that we're still having children being vulnerable. So which means that we need to continue raising the awareness, but it's important for the adults to come to party so that we can then be able to protect our young ones.
I'm hoping we can speak a bit more about that multi-stakeholder intervention, Motalatale, because let's face it, it's no coincidence that we're seeing these cases unfold not in Bryanston, not in Fourways, not in Sandton, but in townships and informal settlements. This suggests to me a much deeper structural issue that needs to be addressed around how residents in those areas can actually keep up with hygiene standards and expectations given the environment they're in.
I think you've hit the nail on the head. There are also socioeconomic issues that are at play that would require a much broader discussion and involvement in terms of the various stakeholders within, because as health, we can only do so much insofar as the health response, insofar as the awareness drives, but what are the determinant factors that also contribute towards this? And I think that is a conversation and a discussion that we need to have broadly as society, so that we look at some of the socioeconomic factors without necessarily taking away, again, the responsibility that you have as an adult, I have as an adult, towards raising children properly and cautioning them. Because, I mean, even some of us, when we grew up, given that we grew up in rural areas, we grew up in some settings that were like that. But I think today we've got a greater risk of health issues that are emerging from all of this environment that we're finding ourselves in. So definitely the socioeconomic factors would also need to be looked in. But while we're doing that, we still need to do the basics, like not really illegally dumping. And I think it's something that we need to continuously conscientize communities on, to say we need to get into the habit of properly disposing of garbage, because sometimes, I mean, you mentioned the urban areas. The reality is that sometimes when one drives through even some of the urban areas, you see that there's a culture that is also emerging now of people just illegally disposing of garbage, where they're supposed to take it to the refuse areas, the municipal demarcated areas. People just dump it anywhere where there's an open field. And I think that's a general problem across Africa that you need to start fighting, because that on its own creates a much bigger problem, where you've got rodents infestation and all of those things, and people then now are trying to fend themselves from that by using all these other chemicals to try and deal with that problem. But indirectly, you're creating also a much bigger problem when you're trying to deal with that. So I think you're quite right in terms of the role that multiple stakeholders need to play, and continuously being able to, I suppose, raise that awareness and deal with some of the underlying factors.
Absolutely. It's always a difficult conversation, especially when you consider just how avoidable this tragedy is. Motalatale Modiba, thanks for speaking to us. We appreciate your time.